Hi guys. One of the most common things that we see in our office and deal with is rotator cuff injuries. The rotator cuff is comprised of four muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles are very easily injured. A lot of times people have difficulty recruiting their big lat muscles, so they just rely on these four rather small muscles, and it's very easy to tweak, strain, and even tear these muscles. So kind of depending where you're at in your treatment progression, we will use four isolated movements along with other progressions with physical exercises to help strengthen and recover from those injuries. These are great exercises, but the most important thing is coming in the office and get treated with active release technique to break up all the adhesions and scar tissue that forms within those four muscles, and along with all the other associated musculature. Okay? So we're going to keep it really simple today. The first two we're going to do is internal and external rotation. So what we're going to do, and with all four movements, we're just going to rely on resistance band or tubing. So we're going to anchor the tube into the outside the door, pull the door closed, step out to resistance. So we're going to do internal rotation first. The biggest thing is we want to isolate these muscles as much as we can. So you're going to tuck that elbow next to your side. You're now going to let those shoulders turn with the tubing. So keep those nice and square, and then you're going to pull across and come back out. So this is internal rotation. We're going to do 10 repetitions. And if that's easy, you can just step further out to resistance. And if you feel that elbow start pulling away from the side, just step a little bit closer, okay? Excellent. The next one we're going to do is external rotation. So if we're doing that same arm, so internal rotation, 10 reps, and then we're just going to turn around and pull across the body. So what it's going to look like with the right arm is take it out to resistance. Again, keep that elbow next to the side and externally rotate. You won't have too much range of motion with this one, and that's okay. What we don't want to see is pulling those shoulders, and try to keep that wrist nice and neutral. So keep that wrist straight. Good, 10 repetitions there. The next one we're going to do, with our resistance tubing, we're going to anchor it onto the ground. With this, I'm just using a fairly heavy 65-pound dumbbell. So the first one we're going to do is empty can. So start here, across the body, end with the thumb pointing towards the floor. Again, keep the shoulders nice and square, not letting that torso rotate. Good, we're going to do 10 repetitions there. And then we're going to, next one is called drawing the sword. So again, start with the thumb down. This time we're going to go through external rotation with the shoulder. So we're going to end with that thumb pointing towards the ceiling. Okay, so these are very easy exercises to do, and you can do it throughout the day. It's very easy to take the tubing with you. Like I said before, the most important thing is to get ART, active release techniques done on the affected areas to restore that range of motion, get out of pain, and then these are great exercises to kind of complement the therapy. If you guys have any questions at all, give us a call at 303-300-0424, or you can visit us online at denverback.com. Have a great day. Thanks, guys.